Mr. Niswonger, thank you for meeting with me.
My pleasure.
How did you get interested in building a children's hospital?
Well, it's kind of an interesting story. First of all, most people don't realize that when you're in East Tennessee, you're actually 30 miles closer to Windsor, Ontario than you are Memphis, Tennessee, where St. Jude's is located. And what was happening was we had a student that was in our scholarship, to be in our scholarship program, who ended up at St. Jude's and was unable to participate in that scholarship. And that began a quest to see how can we, if sick children are really sick, they're not going to have the opportunities that a healthy child will have. And that began just phone calls, and I ended up talking to Dennis Bonderfeck at Mountain States, and they were looking to establish a freestanding children's hospital and with a relationship with St. Jude's. And so that's sort of how the whole project began.
Well, the building is beautiful.
Well, thank you. That was the other thing when we broke ground. We told the mostly adult audience that, look, this isn't for you, it's for kids. And when a child is sick and scared and worried about going to the hospital, we want them to drive up to a facility that would be very inviting to them, and lots of color and play space and playrooms. And so I think we were able to accomplish that. That's different than any building that I've ever built by far.
Well, there's a statue on campus of a young boy with a plane. Is that a statue of you by any chance?
Where'd the last 50 years go? Yes, it is. That was a picture that my mother had taken when I built a model airplane and was launching it. And that was my dog, Doc. So it's a real life shot, yeah.
Is there anything you would like to tell professionals and their families who are considering relocating to Mountain States Health Alliance?
Well, in the years that we've been open with the Children's Hospital, and of course that's where I get most of my feedback, there has never been a single complaint. It's about how caring the staff is and how they treated the families that are having to be at those hospitals as patients, that they're treated like family. And that's the kind of introduction that I really wanted when somebody walks into that they're received well, and that they feel like this is an extension of our family. These people are concerned, and obviously they are, or they wouldn't be in that business.
Well, thank you, Mr. Niswonger, for your time.
It's my pleasure.